What kind of complaints will a person with stone present to you, and then you'll come to know कि okay, this is like a stone issue that he's having.
जब किसी को स्टोन होता है, पत्थर का बीमारी बोलते हैं, किडनी का स्टोन, उनको फर्स्ट थिंग पेट में दर्द होता है. दैट्स द मोस्ट कॉमन.
ऐसे भी पेशेंट्स हैं जिनमें गॉल ब्लैडर स्टोन है या यूरेटर स्टोन्स है या किडनी स्टोन्स है, but then there is no symptoms.
Almost I must say 99% of the time pain is the main symptom. पेन रहता ही है हमेशा.
How will he or the doctor will understand कि must be having some stone issues going on?
There are two ways of detecting a kidney stone. एक तो रूटीन अल्ट्रासाउंड करते हैं. अभी आजकल सब मास्टर हेल्थ चेकअप करते हैं. Many times it's okay. मेजॉरिटी टाइम में गैस का है, सॉल्व हो गया. But then the danger is in wrong diagnosis.
आज बियॉन्ड द पिल में हम बात करने वाले हैं अबाउट किडनी स्टोन्स एंड यूरेटेरिक स्टोन्स विद डॉक्टर गिरीश नेलविगी. ही इज अ हाईली एक्सपीरियंस्ड एंड रेप्यूटेड कंसल्टेंट यूरोलॉजिस्ट एंड डायरेक्टर एट नेलविगी सुपर स्पेशलिटी एंड यूरोलॉजी हॉस्पिटल इन बैंगलोर. आपने कई लोगों को बोलते हुए ये सुना होगा कि मेरे किडनी में पत्थर है, लेकिन ये समझना जरूरी है कि ये पत्थर आता कहाँ से है, बनता कैसे है, एंड मोर इम्पोर्टेंटली हाउ टू ट्रीट दिस कंडीशन. इसीलिए ये एपिसोड हर घर तक पहुंचना जरूरी है. और आगे बढ़ने से पहले डोंट फॉरगेट टू सब्सक्राइब टू अवर चैनल एंड फॉलो अस ऑन इंस्टाग्राम. इट्स वन लाइफ बाय मैनकाइंड स्पेशलिटीज, एंड थ्रू दिस कैंपेन वी आर ट्राइंग टू एम्पावर यू बाय गिविंग यू द राइट इन्फॉर्मेशन सो दैट यू कैन मेक राइट हेल्थ चॉइसेस. तो चलिए शुरू करते हैं. So, just to start with, can you give us like a brief idea that like who exactly is a urologist and about the hospital and where can people actually find you?
I'm Dr. Girish Nelivigi. I'm a urologist. A urologist is a doctor who treats diseases of the kidney, ureter, urinary bladder, prostate, and diseases like urinary tract infections, stones, cancers pertaining to urological organs. Many female urological problems, like many women have got cough and they cough and they leak urine, they have got prolapse of the organ associated with some urinary problems. So these are the broad things that are treated by a urologist. So I am from Bangalore. I work in Bangalore. I have got my own hospital in Bangalore.
So sir, जैसे भी आपने बताया कि you're a urologist and also urologists take care of the stones, renal stones, ureteric stone. But then जहाँ तक मुझे पता है, if someone who's having a kidney stone would go to a nephrologist, right? So what is the difference?
Yeah, see, there is a difference between a nephrologist and a urologist. A nephrologist is basically a physician, that is people who have done their MD degrees, and after that they do a 3-year course called either DNB or DM in nephrology. A nephrologist predominantly treats urinary infections, kidney failures, because of diabetes, hypertension. They are the physicians who deal with the kidney transplants, but the non-operative part. But a person with kidney stones should go to a urologist, because a urologist is a specific person who deals with kidney stones. Even though nephrologists also see kidney stones, but a urologist is a person who deals with kidney stones. So a urologist is a surgeon who deals with kidney diseases, whereas a nephrologist is a physician who deals with kidney diseases. That's how broadly we classify.
Okay. So, considering कि मैं एक patient हूँ and then I've entered your clinic and I am so what kind of complaints will a person with stone present to you, and then you'll come to know कि okay, this is like a stone issue that he's having.
जब किसी को स्टोन होता है, पत्थर का बीमारी बोलते हैं, किडनी का स्टोन, उनको फर्स्ट थिंग पेट में दर्द होता है. दैट्स द मोस्ट कॉमन. 80-90%.
As in which area of the pet?
यूजुअली पेट में दर्द मतलब किडनी स्टोन या यूरेटर का स्टोन. किडनी स्टोन रहेगा तो पेट का अपर पार्ट एंड बैक पार्ट में रहता है. यूजुअली फ्रंट पार्ट में नहीं रहता है. अगर राइट साइड में फ्रंट पार्ट में रहता है, यूजुअली गाल ब्लैडर का या पित्त कोश का पत्थर रहता है. सो यूजुअली जब भी किडनी स्टोन होता है, उनको अपर पार्ट ऑफ द एब्डोमेन एंड स्लाइटली टू द बैक ऑफ द एब्डोमेन रहता है. अगर वही स्टोन किडनी से नीचे आ जाता है, एक यूरेटर में, यूरेटर एक ट्यूब रहता है जिससे यूरिन किडनी से यूरिनरी ब्लैडर में आता है. अगर वो स्टोन नीचे यूरेटर में आ जाता है तो यूजुअली अपर पेट का सामने रहता है और लोअर पार्ट में रहता है. तो वो देख के हमको मालूम पड़ता है कि स्टोन किधर है, किडनी में है या यूरेटर में है. या बहुत बार नॉन स्टोन कॉजेस भी रहता है, अलग अलग रीजन से भी होता है. तो हम डिफरेंशिएट कर सकते हैं पेशेंट को देख के, पूछ के कि किधर क्या हो.
So pain is the only symptom that a person or a patient will present with, because ऐसे भी पेशेंट्स है जिनमें गॉल ब्लैडर स्टोन है या यूरेटर स्टोन्स है या किडनी स्टोन्स है, बट देन देयर इज नो सिम्टम्स.
Almost I must say 99% of the time pain is the main symptom. Pain
Okay.
रहता ही है हमेशा.
Okay.
It is very rare that a patient with kidney stones does not have pain at some point. It is not necessary that a kidney stone patient should have pain. बहुत बार किडनी स्टोन अगर ब्लॉक नहीं कर रहा है तो पेन नहीं रहता है.
हाँ, तो if the patient has come to you and maybe the pain is not the symptom,
yes,
how will he or the doctor will understand कि must be having some stone issues going on?
Yes, so there are two ways of detecting a kidney stone. एक तो रूटीन अल्ट्रासाउंड करते हैं. अभी आजकल सब मास्टर हेल्थ चेकअप करते हैं, रूटीन अल्ट्रासाउंड्स करते हैं जस्ट फॉर एज अ एनुअल हेल्थ चेकअप में इन मेनी सेक्टर्स, इन मेनी आईटी सेक्टर्स एक्सेट्रा. तभी किडनी स्टोन्स एक्सीडेंटली डिटेक्ट हो जाते हैं. अल्ट्रासाउंड में लिखते हैं कि किडनी स्टोन है. पेशेंट को कभी पेन नहीं रहता तभी, क्योंकि वो किडनी को ब्लॉक नहीं कर रहा है या किडनी में इन्फेक्शन नहीं रहता है. तो वो मास्टर हेल्थ चेकअप के बाद वो डॉक्टर के पास जाता है. डॉक्टर उसको देख के बोलते हैं हाँ आपका किडनी में स्टोन है. पेशेंट बोलता है कभी ना मुझे पेन नहीं था.
Correct.
That's how many of them are detected. That's one way of detecting a kidney stone. That is incidentally detected kidney stones बोलते हैं हम उसको. Second, as I said, pain. Pain may or may not be there depending on the obstruction.
Okay.
So if pain is not there, what are the other symptoms of kidney stone? एक तो यूरिन में ब्लड हो सकता है. पेशेंट बोलता है यूरिन में आज यूरिन कर रहा था, ब्लड आ गया.
Okay.
Or sometimes they have some burning sensation when they pass urine. So these are the usual symptoms. Pain is the most common, or blood in the urine, and sometimes burning sensation.
Okay.
These are how kidney stones are detected.
So even when we talk about pain now, as you explained कि it's a diffuse pain जो आगे से पीछे की तरफ travel करता है. Now in our population ये जो भी पेन अगर किसी को महसूस हो रहा है, either if it's on any one of the side, तो people declare it कि maybe it's a kidney stone pain. So you know how to differentiate कि वो कोई muscle pain है या कोई एसिडिटी पेन है या किडनी स्टोन का ही पेन है ये.
जैसे मैंने बोला हिस्ट्री टेकिंग. पेशेंट यूजुअली मेनी टाइम्स किडनी स्टोन पेन स्टार्ट्स इन द मॉर्निंग्स. Usually, early morning start होता है. They get up from the bed. They experience some pain. Or sometimes after traveling because of the jerky movement. So and the pain usually the patient usually comes to the OPD. They say इधर पेन हो रहा है. Here the pain is here and it comes to the front and नीचे भी जाता है. That's a typical kidney stone pain. But as I said, abdomen में बहुत organs रहता है जिसमें पेन हो सकता है. For example, gall stones या पित्त कोश का पत्थर रहता है. Usually gallbladder is the gallbladder is situated anteriorly. That is सामने रहता है. So patient with a gallstone pain usually complains of pain in the front of the abdomen either. It doesn't go to the back. Muscle pains are again typical. They have done some heavy exercise or some jerky movements. So then muscle they show. We know where the muscles are and they show either, for example, they say too much to the back, more in the center. We know it is a muscle pain, not a kidney stone.
Understood.
So depending on where the organs are situated, हम डिफरेंशिएट कर सकते हैं कि किडनी स्टोन पेन है, गाल स्टोन है, मसल पेन है, या गैस का भी पेन हो सकता है. बहुत बार एसिडिटी से भी हो सकता है. दैट इज डिफ्यूज पेन इन ऑल ओवर द एब्डोमेन, मोर इन द अपर एब्डोमेन, एंड टिपिकली पेशेंट हैज ईटन आउट और ईटन सम स्पाइसी फूड. सो बेस्ड ऑन द हिस्ट्री एंड एग्जामिनेशन वी कैन डिफरेंशिएट.
सो दिस काइंड ऑफ पेन, इफ अ मसल रिलैक्सेंट इज बीन टेकन या फिर एन एंटासिड इज बीन टेकन, तो ये पेन चला जाता है. And is it that way? और अगर ये in case by chance if this is like a kidney stone pain, then the pain still stays despite of taking the medicine?
Most of the time tablets are effective. टैबलेट लेते हैं. इनफैक्ट वो डॉक्टर के पास आने से पहले ही वो केमिस्ट के पास जाके कुछ पेन किलर ले लेते हैं. कम हो जाता है. When it happens the second time they come to us, or when it is unbearable they come to us. Now what happens in many situations is painkillers do not relieve the pain, especially if the stone is blocking the ureter. It is a very very severe type of pain. They are wriggling with pain. They have to take injections. They have to go to a hospital, take injection. तभी रिलीव होता है. और बहुत बार ऐसा भी होता है कि despite 2 injections or 3 injections, pain still does not come down. So there is a spectrum in pain intensity. किसी का थोड़ा कम रहता है, जो केमिस्ट के पास गोली लेने के बाद कम होता है, या स्पेक्ट्रम ऑफ इंटेंसिटी इतना सीवियर रहता है कि हॉस्पिटल में इमरजेंसी के आने के बाद भी इंजेक्शन लेने के बाद भी कम नहीं होता है. So there is a big variation in the severity.
You know, these chemists are the first line doctors, I feel, nowadays.
Yes. Most of the people go to chemists if the whether it's for acidity, whether it's for pain, headache, allergic reactions, so they go there.
And then condition खराब करके डॉक्टर के पास पहुंचते हैं.
Many times it's okay. Majority time में गैस का है, solve हो गया तो. But then the danger is in wrong diagnosis.
Correct.
Example में देता हूँ भी, it's not related to stone, but the upper abdominal pain could be because of heart problem also. Right. It's not necessarily gas problem.
Correct.
So when they go to a chemist and think it is a gas problem, start treating, it may get relieved because of some painkiller, antacid.
Correct.
They will miss a serious problem like heart problem. So there is a problem with misdiagnosis also when they don't go to hospital.
This is like a serious issue now.
Yes, it is a serious issue because many of the chemists themselves they dispense medicines. Many times they're right, ailments are small, but when they miss a diagnosis, it becomes a problem.
Exactly, that becomes a problem then. But so when we talk about the stones, जब भी वो size में इतने बड़े नहीं होते, like really mm's, at that time the body is not actually showing any discomfort, you know. So how could a person understand कि ये डेवलप हो रहा है, जैसे कि ये इतने छोटे साइज में ही इसको डिसॉल्व कर देते हैं?
नहीं, बहुत बार जैसे मैंने बोला मालूम नहीं पड़ता है. अगर few millimeter kidneys, some are 2 millimeters, 3 millimeters to begin with. In fact, all of them begin as a millimeter calcification. They grow in size. तो पेशेंट को या किसी को भी मालूम भी नहीं रहता है, या अभी आप स्कैन नहीं किया है तो आपको मालूम नहीं है कि आपका किडनी में स्टोन है, या इवन माइन ऑल्सो. हाउ टू डिटेक्ट इन सच पेशेंट्स? इट इज इम्पॉसिबल टू डिटेक्ट अनलेस द पेशेंट हैज अ हिस्ट्री ऑफ किडनी स्टोन्स. पहले कभी भी किडनी स्टोन हुआ है तो हम उनको एडवाइज करते हैं कि हर साल एक अल्ट्रासाउंड करो, तभी अ फ्यू मिलीमीटर स्टोन कैन बी डिटेक्टेड इवन बिफोर सिम्टम्स स्टार्ट.
ओके,
दैट्स हाउ वी डिटेक्ट. अदरवाइज विदाउट अल्ट्रासाउंड इट इज जस्ट इम्पॉसिबल टू डिटेक्ट अ किडनी स्टोन even when there is no pain.
Unlike other metabolic diseases, is there like a genetic role to play in this?
It is like every disease in the human body, or I must say most of the diseases, there are multiple components, multiple causes. एक तो genetic component है. Genetic component is what happens at a cellular level in your DNA.
Correct.
Second thing is the lifestyle or acquired problem, like our lifestyle, the diet, the exercise. So many things also play a role in formation of kidney stone.
Understood.
So both components are important, and the genetic component we call it a metabolic component.
Okay.
Technically, as far as stone is concerned, because stones metabolic defect बोलते हैं हम, body metabolism में.
Okay, correct.
Like many other diseases.
Right.
So there are both components. One is a innate, genetic, and second is a acquired.
Okay, so now you know we say कि kidney stones or any stones in the body forming in any of the urinary tract organ, we call them as like modern lifestyle diseases nowadays. So have you seen like a prevalence really increasing from earlier to now?
Yes, it seems to be increasing. We don't have hard statistics for it, but if you go by the number of patients who come, the frequency, it seems to have increased. पहले जितना stone था और अभी there is a difference. There are so many diseases whose frequency has increased, like stone also. This could be related to some lifestyle changes. For example, we know that obesity, overweight or obesity is one of the risk factors for many diseases, including stone disease.
Okay.
So obesity as an epidemic has increased in our society and all societies. So the incidence of stone also has increased. I think at a societal level, this is a common cause.
Okay.
Of course, at an individual level, other factors play a role. For example, dehydration status, repeated urinary infections, but that is at an individual level.
Okay. So you think that geographically also the prevalence is more? Yes.
There is a definite difference in geographical locations in everywhere in the world.
Okay.
Some countries, some regions are more prone to stones and some less. For example, अगर आप इंडिया का बात करेंगे, इंडिया में the highest prevalence of stone or the incidence of stone is in the northern part of India.
Okay, why so?
Northern part of India, when I talk, it extends from not only the India but Indian subcontinent बोल सकता हूँ.
Okay.
Stretching horizontal belt from Afghanistan, Pakistan, India में पंजाब, गुजरात, राजस्थान, हिमाचल प्रदेश, part of उत्तर प्रदेश, Pradesh, and it
Okay.
goes beyond that.
Okay.
As you come more south, the incidence of stone comes down.
Like, what is the reason behind it?
Maybe the water,
Okay.
very likely, and second, the climate also.
The borewell water.
Could be the borewell water. The calcium content. See, there is a very hard, difficult to say whether the calcium content in water influences the stone formation.
Okay.
There is no hard data.
Okay.
In fact, the data is very confounding. अभी कोई स्टडीज है जिसमें बोलते हैं कि कैल्शियम ज्यादा पानी में होने से भी ज्यादा स्टोन्स का इंसिडेंस नहीं है, ऐसा भी स्टडीज है.
Okay.
But certainly one is climate and could be related to water also. These are the two things which are responsible. Hot climates have more stones.
Okay.
And could be the mineral content of the stone also influence the incidence of stone. अभी see, we are having this interview in Bengaluru now. अभी मैं बेंगलुरु का बात करूं, कर्नाटका, the northern part of Karnataka has got a higher incidence of stones as compared to the southern part of Karnataka.
Okay, so maybe definitely I think the water has to
could be very likely because the northern part of Karnataka is hotter and maybe the mineral content is different as compared to this. अभी बेंगलुरु में ही, and not only the incidence, the size also, the complexity of the stones. That's even interesting. If you see in Bengaluru, the stones are usually not very large. But if you go to northern part of Karnataka or even North India, when I talk of Rajasthan, Gujarat, the stones there are pretty big. We call them staghorn stones.
Oh God.
Extending to 1 centimeter, 2 centimeter, 3 centimeter, which is so unusual to see in this part of Karnataka or the country.
Right.
So it's very interesting. The location, the geography influences the number as well as the complexity.
Yeah, so now people will blame the geography and the water, not their lifestyle for it.
You can't do much about geography. You can't do much about genetics.
Correct.
Yeah, you can't change from one state to the other. You can't change your genes. But the only thing that we have an influence is our lifestyle.
Correct.
And as I said, not only stones, but lifestyle influences so many things. The incidence of heart attack, diabetes, obesity, hypertension, so many things. So at least those things we can change.
So now that you touched upon calcium composition in the water, I don't know if this is a myth or fact that in taking a lot of calcium supplements or even the dietary food which has more calcium in it increases the risk of stones. Is it that way?
No, there is no scientific evidence for it. Even though if you see intuition wise, logically, हम ये बोल सकते हैं कि जितना आप कैल्शियम ज्यादा खाते हैं उतना स्टोन ज्यादा बनता है, क्योंकि किडनी स्टोन सब कैल्शियम ऑक्सलेट का ही रहता है. दैट इज अ लॉजिक. सो मेनी थिंग्स व्हिच आर लॉजिकल डू नॉट स्टैंड टू स्क्रूटिनी. जैसे ये है फैक्ट. अभी साइंटिफिक स्टडीज काफी करते हैं लोग. हाइपरटेंशन क्यों होता है, डायबिटीज क्यों होता है, स्टोन क्यों होता है, और ज्यादा कैल्शियम खाने से स्टोन ज्यादा होता है कि नहीं, वो काफी स्टडीज हुआ है. ऐसा कोई प्रूफ नहीं है कि आप जितना ज्यादा कैल्शियम कंटेनिंग फूड खाते हैं उससे स्टोन बढ़ जाता है. ऐसा कोई स्टडी नहीं है. इनफैक्ट देयर इज नो एविडेंस. फॉर एग्जांपल, मिल्क contains calcium. तो दूध ज्यादा पीने से स्टोन बनता है? No. There is no study which proves that. या dairy product, या like cheese, curds, all those things, ऐसा भी नहीं है. जैसे मैंने अभी 5 minutes पहले बताया, पानी में अगर कैल्शियम ज्यादा है उससे स्टोन बढ़ जाता है क्या? वो भी एविडेंस नहीं है. See, it's so complex. Even though logically we think कैल्शियम ज्यादा खाने से स्टोन, ऐसा नहीं है, कुछ भी नहीं है. So we can call it a myth. So far, yes, scientifically.
Okay. So, what do you think would be the reasons then, for developing the stone? Other than geographical placements, other than that, what could be the main reason that people are living with the stones and proudly telling कि वो मेरे पेट में या मेरे body में पत्थर है?
Dehydration plays a major role. Dehydration in the sense, usually once आप पानी कम पीने से यूरिन कंसंट्रेट ज्यादा होता है. जैसे हमको मालूम है समर्स में यूरिन येलो कलर का होता है. जब हम पानी ज्यादा पीता है इट बिकम्स कलरलेस. सो येलो कलर मींस कंसंट्रेटेड यूरिन. कंसंट्रेटेड यूरिन में क्या होता है, देयर इज ऑलवेज, आवर यूरिन ऑलवेज हैव कैल्शियम एंड ऑक्सलेट एज कंपोनेंट्स. कंसंट्रेटेड यूरिन में कैल्शियम कंसंट्रेशन और ऑक्सलेट कंसंट्रेशन ज्यादा होता है. बोथ ऑफ द मिक्स and form calcium oxalate crystals. And calcium oxalate crystals precursors are the first step in formation of stones. If you see 90-95% of the stones calcium oxalate से बने होते हैं. There are other components, but so dehydration is a very important thing. That's why we see more stones in summers and less in winters.
So you think if dehydration is really the cause, then ज़्यादा पानी, अगर जिसको कोई स्टोन है वो बहुत ज्यादा वाटर इनटेक कर रहा है तो स्टोन विल गेट रिमूव्ड एंड द पर्सन विल नॉट गेट इट लेटर देन इफ ही कीप्स हिमसेल्फ हाइड्रेटिंग.
हाइड्रेशन हेल्प्स, बट इट इज नॉट मैजिक.
Okay, understood.
एग्जाम्पल हम सबको एडवाइस करते हैं पानी ज्यादा पी लो एंड दैट इज अ करेक्ट एडवाइस. So when we say drink more water, what exactly it means is, see, some people say I get up at 6 in the morning, I drink 1 liter of water.
Yes.
No, that is not helping very
Correct.
much. You should spread
Right.
out your water intake over 24 hours.
Okay.
क्योंकि ऐसा नहीं है कि आप सुबह स्टोन का इंसिडेंस ज्यादा है, आफ्टरनून स्टोन नहीं बनता, ऐसा नहीं है. यूरिन इज कॉन्स्टेंटली
Right.
फॉर्मिंग क्रिस्टल. सो हम बोलते हैं कि यू ड्रिंक मोर वाटर बट स्प्रेड इट मॉर्निंग, आफ्टरनून, इवनिंग, नाइट, एटसेट्रा.
Okay.
That is a advice we give to everyone, and
Okay.
especially in summers the water intake has to be more. ये advice देते हैं हम. That helps, but as I said, there are genetic components which cannot be circumvented.
Correct. Right.
So
Understood.
people drink lot of water, still they come back with stones.
Okay. So there could be some other idiopathic condition.
More than idiopathic, we say it is at a cellular level. Their kidneys are tuned to concentrate calcium and oxalate more than other kidneys. For example, किसी का स्टोन बनता है, किसी का नहीं बनता है, तो उनका किडनी मेटाबॉलिज्म अलग रहता है, इनका किडनी मेटाबॉलिज्म अलग रहता है.
Understood. Okay.
वो क्यों अलग रहता है? That is again because of a genetic reason. At this point, I would like to differentiate genetic from hereditary. They are different things. Most of people should not get confused. Hereditary is what comes from your parents to you.
Right.
Genetic is what is there at your cellular level as determined by your DNA.
Okay.
It is true that on a hereditary basis in families, because if your parents have a stone, you have got a higher chance of getting a stone.
Okay.
But it is not necessary always that your father or mother should have a stone for you to have a stone. So
Yes.
that is genetic.
So,
So something has happened at your level, at your individual level, which predisposes you to get a stone. So
Okay.
these are fine distinctions. Since people are watching, many may be interested,
Right.
I'm telling, but it is not directly important when we discuss stones. So
That's
you
true.
can say it runs in families, it's hereditary, it's genetic. You can use all those words. Even though they are in science, they are different.
Okay. I mean, thank you for that clarification because even that was a new update for me as well.
Yes.
But you know, पहले हम लोग सिर्फ ये जो stone की problem है, we used to see people who are above 50 or above 45, they used to get this kind of issues, you know. But now, I think the condition, I mean, the time has changed. Even kids are like getting kidney stones.
See, children, sometimes it's very rare for children, but it is possible that they get kidney stones. Again, there I think it's more of a metabolic cause than a lifestyle problem. Because
Okay.
ultimately in a child, what lifestyle adjustments
Right,
can you do?
right.
In an adult, we can tell them not to eat that, drink
Hmm.
more water. In a child, for example, 3-year-old child, 4-year-old child who gets kidney stones, it's a metabolic problem rather
Right.
than this thing.
Right.
And youngsters, of course, I think the incidence has increased. Probably that has got something to do with
Smoking,
lifestyle
alcohol.
also. Some things can be corrected, some things cannot be.
So if someone who's coming with the stone to you and you come to know after doing some certain screening part of it, what do you like? How do you advise them? Ki, is the surgery required or can you? Because I've seen people living with the stones with them.
Yeah, but before we go to that, we should make a diagnosis.
Yes,
हम
yes.
ये टेस्ट
Correct,
करके प्रूव
correct.
करना चाहिए कि उनको स्टोन है.
Right,
पेशेंट
right.
आता है पेन से, हम कुछ टेस्ट करते हैं कि ये पेन किसके लिए है और एक किडनी स्टोन से, अगर स्टोन है तो किधर है. ये सब टेस्ट करने के लिए यूजुअली हम अल्ट्रासाउंड ऑफ द एब्डोमेन या स्कैन कर सकते हैं. ऑलमोस्ट 80-90% टाइम दैट्स गुड इनफ. समटाइम्स दैट डज नॉट डिटेक्ट फॉर वेरियस रीजंस. तभी हम सीटी स्कैन करते हैं.
Okay.
CT scan is a more advanced test that can detect stones to almost 100%
Okay.
degree of
Okay.
certainty से detect करता है. These two are enough to detect kidney stones. उसमें हमको काफ़ी जानकारी मिलता है, स्टोन किधर है, क्या साइज है, उसे ब्लॉक हो रहा है कि नहीं. Depending on that, we do some further tests if necessary. So depending on this, then we advise the treatment.
Okay. So like, how do you decide कि अगर gallbladder में stone है तो should you keep it, not keep it, या फिर
Yeah.
kidney या फिर renal ureter stones?
Yeah. So once हम diagnose kidney stones or ureteric stone, then हम ये देखते हैं कि साइज क्या है. Usually small kidney stones, we tell them to keep on drinking more water that they flush out. Usually हम
Okay.
treatment नहीं देते उनको.
Okay.
Because they don't cause any symptom. But on the other hand, as the size of the stone increases, the chance that it causes pain is high. या किडनी से यूरेटर को स्लिप होने का चांस है, anything more than 5 millimeters, 6 millimeters, etc. Then we advise them to treat them.
Okay.
So what are the treatments? I can elaborate right now.
Yes.
The treatments for kidney stones. As I said, small stones, 4 millimeter, 3 millimeter, we don't advise any treatment except water.
Okay.
क्योंकि लोग बहुत बार पूछते हैं कि कुछ आयुर्वेदिक मेडिसिन लेने
Yes.
से या होम्योपैथी लेने से या इवन इन एलोपैथी आर देयर एनी मेडिसिन which can dissolve stones. ऐसा कोई भी नहीं है.
Okay.
I am certain about allopathy that there is nothing. Even in homeopathy and Ayurveda, I see many people, they try various remedies, they come. So even in other systems, there is nothing which dissolves stones, but
Okay.
I would stick to allopathy because
Okay.
I'm an allopathic doctor.
Okay.
Now, जैसे स्टोन का साइज ज़्यादा होता है, देर आर वेरियस मेथड्स. फॉर एग्जाम्पल साउंड वेव्स या शॉक वेव से हम ट्रीटमेंट देके स्टोन को ब्रेक कर सकता है और फ्रैगमेंट्स यूरिन में आते हैं. उसको ESWL बोलते हैं या लिथोट्रिप्सी बोलते हैं. फॉर अबाउट अ सेंटीमीटर 1.2 1.3 सेंटीमीटर साइज हम इसको ये एडवाइस कर सकते हैं. या अगर उससे बड़ा स्टोन है, ये शॉक वेव लिथोट्रिप्सी मे नॉट बी दैट इफेक्टिव, तो तभी हम एंडोस्कोपी एडवाइस करते हैं. एंडोस्कोपी में क्या करते हैं? एंडोस्कोपी में यूजुअली एनेस्थीसिया देते हैं. ऑपरेशन थिएटर में एक यूरिनरी पैसेज में एक एंडोस्कोप पास करके वी गो टू द किडनी, वी यूज अ लेजर एंड पाउडर द स्टोन. ऑन दोज पाउडर, दैट पाउडर इट कम्स आउट इन द यूरिन. उसको हम यूरेट्रोस्कोपी बोलते हैं या RIRS बोलते हैं. सो बोथ आर एंडोस्कोपिक प्रोसीजर्स.
अंडरस्टूड.
या अगर उससे बड़ा है स्टोन या बहुत हार्ड है, यूजुअली थ्रू द नेचुरल पैसेज हम एंडोस्कोप पास करने के लिए बहुत मुश्किल होता है या इफेक्टिव भी नहीं रहता है. तभी हम एक प्रोसीजर करते हैं जिसका नाम है PCNL. PCNL is a procedure where we make a small cut in the back because, as I said, kidney is located here under anesthesia, enough to pass an instrument the size of a pen. तो अंदर जाते हैं, किडनी का अंदर, we see the stone, we break the stone and remove the pieces then and there itself. So this is a surgical procedure. This is called PCNL. So the treatment depends on the size of the stone and also the hardness of the stone.
Understood.
And some other factors.
So what would happen if the stone is being left untreated या फिर like a really big size stone is not been removed surgically?
See, untreated stones, they may cause pain, and sometimes they go down into the ureter, cause blockage. Blockage होने से pain severe रहता है, sudden acute pain रहता है. Patient has to come to the hospital as an emergency patient. So one is pain, second is a blockage which is an emergency, third is infections हो सकता है. Kidney stones block करने के बाद kidney infections हो सकता है, urinary infection हो सकता है. And another consequence is blood in the urine.
Right.
Yeah, kidney को there is a friction
scary,
होता है, urine में blood आता है. That's very alarming to the patient.
Understood.
So these are the things that may happen with untreated stones.
So other than this incidental pains, if the patient is not going through any other symptom, how do you convince them कि you need to undergo the surgery or endoscopy even if it's like a more than 5 centimeter stone?
The urologist will have to decide whether it merits treatment or not. अगर बहुत छोटा है, जैसे हम ट्रीटमेंट नहीं देते, मगर उससे बड़ा है, हम यूजुअली उनको एडवाइस करते हैं ट्रीटमेंट लेने के लिए. ट्रीटमेंट एज आई सेड कुड बी नॉन ऑपरेटिव ट्रीटमेंट या ऑपरेटिव ट्रीटमेंट, वो अलग बात है.
Do they agree to it?
See, it depends on the patient and we should make them understand the problem with untreated stones. Obviously it depends on their education level, their own their understanding of human body. Listen to us, some of them agree, some they speak to their friends, families, etc. So there are various factors, and as a doctor it not only applies to stone. Correct. Even diabetes patients have got high blood sugar. Not all of them take treatment.
Right. True.
हम बोलते हैं कि आपका ब्लड शुगर ज्यादा है, ट्रीटमेंट लेना चाहिए. मेजॉरिटी एग्री. देयर आर सम पीपल हु से नो, आई विल ट्राई herbal treatment, or some say I'll try only diet. So different people respond in different ways. Right. And many people, they say no, I don't. There are people, rare, but who don't get treated for diabetes at all. So this response is there not only stone, with any disease, including cancers.
I mean, that is the case everywhere.
Yes, including cancers.
So I have a family member who had got this kind of stone and he got it surgically removed. But then after that, he has stopped eating tomatoes, spinach, and ladyfinger. Stopped taking calcium.
Brinjal, many of them just stop brinjal.
So how true is that? You
are absolutely right. It is very common to stop eating the vegetables and the food product that you told, because all seeded vegetables, they contain oxalate.
Okay.
Yeah, they contain oxalate. So again, as I said, the logic is if you reduce oxalate or calcium in your food, the stone incidence comes down. As I said, there is absolutely no evidence
right.
that this works. They contain oxalate, but stopping oxalate consumption is not going to bring down the chance of having a kidney stone. You ask any urologist, we don't give that advice.
Okay.
Yeah, we don't give strong dietary advices like stop eating this, stop eating this.
Okay.
So I tell them you can eat everything in moderation.
Okay.
आप टोमेटो भी खाओ, ब्रिंजल भी खाओ, लेडीज फिंगर खा सकते हैं, या फॉर एग्जांपल टी contains oxalate.
Okay.
या कंटिन्यू ड्रिंकिंग टी. You don't have to stop drinking milk or dairy product. ऐसा कुछ नहीं है. You do everything
but in moderation.
In moderation.
Understood.
Yes. So there is no specific dietary no to any patient with kidney stone.
And then where has this myth come up with कि have beer?
See, I'll tell you about beer. Beer से क्या होता है? Beer, it is a diuretic agent. In the sense, it increases urine output. आप beer पियेंगे, increases the urine output in the kidney. There is a fact. It is a fact that small ureteric stones, अगर आप suddenly थोड़ा urine output increase करेंगे, तो may small stones come out. So it is a fact, even though it is a politically incorrect way of telling drink beer. I won't advocate drinking beer, but small stones too are helped, no doubt about that. But the problem with drinking, it has got its own other side effects.
Correct.
That's why I don't advise them to drink beer. But some people say, "मैं beer भी पिया." I don't tell them, "No, you're wrong." You see?
Really?
So because we have to be scientific at the same time.
Okay.
Yeah, as I said, if I say. Many people say I drink 6 liters of water every day, but still I get stone. That is a fact. In the same way, small ureteric stones are flushed out by beer because of its strong urine increasing action. That is also a fact. But then everything has to be seen in the cost benefit perspective. So can you drink beer every day because you have a stone? No, obviously not. Because it has, the calorie problems.
Right.
And ethanol, it has got its own problem on the liver and brain, etc. So certainly we don't advise that.
No, because I know that alcohol leaves you with dehydration.
Correct. Alcohol leaves with dehydration, so they have to hydrate themselves well. That is important. Otherwise, yes, it takes away the water content.
It's not the right way of dissolving stones.
It's not the right way, certainly, of flushing out. And dissolving may be the wrong word. Flushing out may be the right word. Yes. But certainly, we don't advocate that.
Okay. So, this coming to one more thing about now we all know that we get renal or kidney stones. That's common, and there's quite a lot of awareness about the same. But then you talk about ureteric stones. I mean, there is not much information circulating around it.
Yeah, ureteric stones are the more problematic stones because they are the ones which bring a patient to the hospital.
Okay.
Kidney stones, बहुत बार pain नहीं होता. Ureteric stones almost certainly pain होता ही है because ureter is a tube and it's blocked by a stone. It causes severe pain. Popularly, सब हम kidney stones बोलते हैं. Patient बोलते kidney stone था. Actually, what they mean is ureteric stone.
Okay.
हाँ, because kidney is a more popular organ, well-known organ, but most of the time the stone pain that you see is because of ureteric stone. So small stones get stuck in the ureter, and uska treatment hai very small ones like 3-4 millimeter conservative management. Pani zyada peene ke liye bolte. There are some drugs which help in flushing out these stones, etc.
Okay.
But the larger ones will have to be removed.
Surgery.
By endoscopy. आजकल तो हर चीज endoscopic surgery है. Very few people. No one cuts for stone anymore.
Right. Like very less hospitalization.
Yes.
Is it only like 1 day procedure?
Yes, absolutely. 1 day procedure.
And after that, the patient can resume his work?
Yes, they can go back to the normal work the very next day.
And then are there certain lifestyle modifications that they have to follow?
As we discuss about lifestyle, I think the only controllable factor is hydration. They should keep hydrated. And other than that, there is no major modification that we advise. Obesity, as I said, reducing body weight helps for everything, not only kidney stones, but other things also.
Correct.
So that's another advice that we give them. Hydration with that. And don't eat too much red meat. Red meat is another factor that is associated with stones. Yeah, people who habitually consume red meat and habitually form stone, हम उनको बोलते हैं कि red meat कम खाओ. Red meat मतलब mutton, beef, all those things. Yes.
Okay, understood.
These are all meats that look red are red meat. So they are the ones which have to be decreased.
So just one last query is that are these stones anytime cancerous?
No, stones do not cause cancer.
Okay.
So And there are situations, but I will not dwell into that. But the answer is no, they don't.
Okay.
Yes.
All right. So, any one important advice that you would want to give us to our viewers?
Yes. One is, if you have a history of kidney stones, you should know that they come back.
Yes.
Yeah. You get a surgery done or the stone goes out, but there is a 10% chance of getting a new stone in 1 year. They have to get themselves checked every year by doing ultrasound. हर साल एक बार अल्ट्रासाउंड करने से छोटा स्टोन्स डिटेक्ट होता है, मालूम पड़ता है कि कुछ, so that they can take some remedial measures when the stone is small. And we should hydrate ourselves well, especially in summers. Summer में suddenly incidence of kidney stones increase. That's winter में कम होता है. So that is such a clear-cut situation.
Right.
So hydration helps. Lifestyle, not avoiding, decreasing, reducing red meat consumption and reducing body weight. So these are the things which we can follow and reduce our chance of getting a kidney stone.
Okay.
We can't eliminate it totally, but at least we can decrease the chance of getting a stone.
All right. We have kept as a rapid fire. So, but here I want you to give like a very crisp and short answer. So we can start. So first one is kidney stone कौन से size का naturally pass हो सकता है बिना surgery के?
Usually 4 से 5 मिलीमीटर का साइज का स्टोन, जो फॉर एग्जांपल 4 to 5 मिलीमीटर इज द टिप ऑफ माय फिंगर, एकदम छोटा रहता है. जैसे आप फॉर एग्जांपल दाल, लेट अस से द साइज ऑफ दाल जो उसका साइज का यूजुअली पास होता है स्लाइटली लार्जर देन दैट बाय ड्रिंकिंग मोर वाटर, नेचुरली पास होता है.
क्या बियर से किडनी स्टोन निकलने में हेल्प होती है?
हेल्प होती है, मगर उनका बाकी हेल्थ साइड इफेक्ट होता है, इसलिए हम एडवाइज नहीं करते हैं. और वो भी बियर से निकलने के लिए वेरी स्पेसिफिक, वेरी स्मॉल स्टोन्स एंड नॉट always. That's why we don't advise drinking beer as a way of treating kidney stones.
Okay. Kidney stone की प्रॉब्लम क्यों शुरू होती है?
किडनी स्टोन के प्रॉब्लम बहुत बार हम मेटाबॉलिक डिफेक्ट बोलते हैं, जिससे हमारा बॉडी में कैल्शियम और ऑक्सलेट सुपर सैचुरेट होते हैं, हम सुपर सैचुरेशन थियरी बोलते हैं, होते हैं, which is a innate situation in your body that is detected by your that is dictated by your genes. Plus there are acquired causes also. So it is both genetic as well as acquired.
ये stones की चीज किस चीज से बनी होती है, यानी उसका composition क्या होता है?
More than 85% of the stones, उनका composition calcium oxalate रहता है.
Okay.
Sometimes in remaining 15% uric acid हो सकता है.
Okay.
As a cause of kidney stone. Mixed हो सकता है. Magnesium ammonium phosphate stones हो सकते हैं.
Okay, understood.
Yeah, these are the common causes.
So if sometimes people get this headache and they keep popping painkillers, is that a cause for kidney stones?
Painkillers do not cause kidney stones.
Okay.
Yeah, painkillers, we call them NSAIDs. They may cause kidney damage. Yes, but the mechanism is different.
Okay.
So, but not kidney stones.
Energy drinks like, as I said, cola and all, are they responsible for developing the stones?
Many of these carbonated beverages got a higher chance of inducing the formation of kidney stones. Okay. So we advise them to restrict carbonated beverages as much as possible, especially people who already have formed kidney stones. उनका चांस ज्यादा रहता है.
And then what do you think about black coffee? There are many people who get addicted to taking black coffees more than 3 or 4 times in a day.
Black coffee, no, it does not increase. उससे कुछ ज्यादा incidence नहीं है kidney stone का.
And then one last thing, that these bodybuilders take a lot of supplements.
Yeah.
Be it proteins or calcium tablets and all those things. So does that show any?
So many of the bodybuilders, they take protein supplements, they take creatine to build up their bodies and their muscles. There is no evidence that they form kidney stones. But then there are some studies which show that excess protein intake or creatine intake predispose a patient, person, not a patient, a person to having some kidney damage because of increased filtration rate.
Okay.
So kidney stone के लिए हम वो stop करने के लिए advise नहीं करते, but chronic consumption of these dietary supplements, as that happens in gym for muscle building, we always advise them not to overdo it.
Okay, understood.
Yes. Certainly.
Right. So thank you so much for being us and really answering rapidly. Thanks a lot.
Thank you very much.
Thank you for listening to Beyond the Pill, जहाँ health का मतलब है conversation. So don't forget to subscribe to our channel and also हमें comment section में बताएं कि आपको इस episode में क्या अच्छा लगा and share it with someone you know कि जिसको ये episode helpful होगा. मिलती हूँ आपको next episode में. Until then, stay informed, stay healthy.